Today topic of discussion is Glycosuria. Now we want to know what is the difference between Glycosuria and Glucosuria. Glycosuria means it indicates the presence of any reducing sugar in the urine. It may be glucose, galactose, fructose. Any reducing sugar present, that means Glycosuria. What is Glucosuria? Presence of only glucose in urine. So what is Glycosuria? It indicates the presence of only glucose in urine. This term using only excretion of glucose. Excretion of fructose in the urine, call it as fructosuria. Excretion of galactose in the urine, call it as galactosuria. Small amount of glucose is presented in the urine is normal, where the amount of urine glucose is more than 25 mg per deciliter, 25 mg per deciliter in the random fresh urine. Now coming to types of glucosuria: alimentary glucosuria, diabetic glucosuria, renal glucosuria, nerves or emotional glucosuria. What are the types? Alimentary, diabetic, renal, nerves or emotional. First we will discuss about alimentary. Some individual after meal there is rapid rise in the blood glucose which is excreted in the urine. This is called alimentary glucosuria. After meal the rapid rise of blood glucose which is excreted in the urine. This is called alimentary glucosuria. This is seen in some normal people. Gastrectomy or in hyperthyroidism. This alimentary glucosuria seen in some normal people, gastrectomy or in some hyperthyroidism. Here fasting and 2 hours blood glucose level are normal, but there is rapid rise in blood glucose is seen after injection of diet. This is due to an increased rate of absorption of glucose. Second type of glucosuria is diabetic glucosuria. Most common cases of glucose excretion in urine is diabetic. So glucose appear in urine when the plasma concentration of glucose excited the renal threshold. That is, whenever the blood glucose level is more than 180 mg per deciliter, it is excreted in the urine. Whenever plasma concentration of glucose exceed more than 180 mg per deciliter, okay, it is excreted in the urine. Third one is renal glucosuria. It is due to reduced renal threshold for glucose. The normal renal threshold for glucose is 180 mg per deciliter. When the renal threshold is lowered, glucose is excreted in urine. So normal renal threshold is 180 mg per deciliter. When the renal threshold is lowered, glucose is excreted in urine. Renal glucosuria also associated with renal diseases with renal tubular transport defect. For example, Fanconi syndrome. In this case, glucosuria is seen along with amino acid urea and phosphate urea. Renal glucose is lowered in physiological condition like pregnancy. About 10% of women shows renal glycosuria the last trimester of pregnancy. Last one is nerves or emotional glucosuria. It is due to stimulation of sympathetic nerves in the liver. Because of this, it reached to increased breakdown of liver glycogen, which produces hyperglycemia and glycosuria. It produces hyperglycemia and glycosuria. Sympathetic nerves excitement stress the time produced glycosuria. This is all about glycosuria and glucosuria. Thanks for watching.